Okay, Damien here to show you some more patient lift equipment today. This product that I'm going to show you today is the 400-pound lift, but what I'm wanting to show you now is the slings and how the slings work with the lift. So this little lift here is great for small spaces. As I was saying in an earlier video, it'll go down about this low here. You can see it's quite a distance from the ground, so it doesn't go quite as low as some of the lifts because it's shorter and smaller. It goes up in the air, but as you go up higher you get closer to the actuator, which makes it harder to rotate the person. It does the job though if you need a really small lift for a small environment. Now we need to understand how to use the slings with the lifts. I'm going to start off with the most common sling, which is a universal sling. And you can see it's shaped kind of like a horseshoe. That's designed that way so that we can place it around the patient while they're in the chair without the need to lift them. This particular version is a medium, where it's available in anywhere from small to extra, extra large. So we can cover all kinds of weight ranges. So here's how we apply the sling. We're going to take that horseshoe and we're going to hold it upside down like so. We're going to hold it with the straps facing the patient right now. Then we're going to take the bottom part of this horseshoe and we're going to tuck it down until the bottom part of the horseshoe touches the chair. Not any further. We don't need to put it underneath the person's bottom. We just want it to touch the chair. The next step is always use good body mechanics when you're applying the sling, by the way. Get down to the right level so you're not tugging and pulling at a high level, hurting your back. We're going to take the edges of the sling and bring them around the hips and then underneath the legs and give them a little tug. Last step is to crisscross the sling. Now we're going to connect the sling to the hanger bar, to the spreader bar, to make the transfer. Now if you noticed on this sling, there's 3 sets of loops on each side, shoulder, midsection, and leg. So on both sides, and you got 3 hooks. So you'll probably already understand what we need to do next. We're going to open up the base, approach the individual with the lift, and we're going to connect the sling. Now you see these loops here? What I'm going to do right now is I'm going to put my patient in a lying down position, and the way I'm going to do it is I'm going to attach the loop that's the furthest away from the sling on the shoulders, the furthest away on the middle, and the highest on the leg. That will allow me to recline the patient back while I raise them up. The shorter you make the legs, the longer you make the shoulder area, the more it tilts the person back. If you do the opposite, it's going to sit the person up. So you can control that positioning. So when you're going from the chair to the bed, you're going to want to lay the person back. It makes the person go higher in the air, plus it makes the person in the right position when they're going to bed. So when you hit the up button, you always want to pay an extremely close attention to the loops. You want to make sure there's no chance of disconnecting the loops from the spreader bar. That's the most common reason for somebody getting hurt, is somebody not paying attention to the loops and one of them not being hooked up right. So we can see here that we got all the loops hooked up. We're hitting the up button here. You can see that the motor on the lift is raising that boom up. You okay? And up we go. You can kind of see that the patient is laying back because of the short here and the long here. But you can also see that with a lift this size, and even someone as small as you are, you can see that the legs are all really close to here, which is something you can't avoid with something this small. But it still accomplishes the objective, which is getting you up. You just have to pay more attention to the leg area to make sure that you don't come in contact with the actuator or create any bruising. So now I'm going to transfer this patient into bed. The lift is always going to be more stable with the base opened, but it is okay to close the base on the lift. What causes potential tipping issues with any kind of lift is when the center weight goes outside of the legs. You always want to keep your weight centered over the spreader bar in the middle of the lift for the transfers. So it's safe for you to do that as long as you close the legs, as long as you pay attention to where the patient is. Now you can see we take the patient over the bed. Kind of pay attention to where the head and the bottom are going to end up so that you get the patient in the bed the right place the first time. Hit your down button on your remote, and we should have our patient in bed in no time. Now after we get this patient down, we're going to demonstrate how you would apply the sling to the patient while they're in bed, because that's a little more difficult than applying it when they're in the chair because of the way you have to move the patient to get the sling in position. So we're down good enough to remove the sling. Now, when a patient's in bed, of course the sling's not typically underneath them like it is now. So I'm going to go ahead and have you sit up just to remove the sling. So go ahead and lay down. And you can see here that when a patient's laying in bed, you're not going to be able to just simply tuck the sling under them instantaneously. You're going to have to roll the patient from side to side. Now there is a technique you can use to raise the bed head up on the bed so a patient is more in a semi-sitting position. And then you can apply the sling the same way you applied it when the person was in the chair, if the patient can tolerate that type of position in the bed. But a lot of times when you're using slings like this, the patient simply can't sit up as well or doesn't have as much control over their body, so they need to be completely transferred. So the way that you would do that is you would measure up your sling first to your patient to make sure you know where it's going to end up. Kind of fold it in half, like so. Then you kind of take a look here. Okay, we want it to be at the shoulders and right above the coccyx area, so right here. And so then you're going to want to roll your patient over just slightly, like so. Take that sling that you folded in half and tuck it in the right position. Put it over the shoulder, flip this piece of material there, and then kind of tuck some additional material underneath the patient. So you can kind of see what we're doing here. And we flip back, and we come back the other way. And then pull the sling back underneath. So you can see that with this kind of transfer, it's kind of impossible to use perfect body mechanics because of the nature of rolling the patient side to side and applying the sling. So you have to do the very best you can in minimizing the amount of exposure to your back that you have during that process. But once we have the sling in position, the rest of the process is pretty easy. We just bring it between the legs, just like we did before. Crisscross the sling. And now we're going to transfer the patient from the bed to the chair. Approach the patient with the lift. Connect the sling to the hanger bar. Now in this case, we're going to want the patient to sit up. So if we want the patient to sit up, we're going to connect the shoulders at their lowest point. We have to lower this down a little bit. The middle section at its lowest point. And the legs at the lowest point. So what we essentially were doing is with the way we've attached the sling, is that it's going to pull the head and shoulder area up first. And then you're going to see the legs getting tension last. So it kind of pulls you into somewhat of a seated position. So that way when I go from the bed to the chair, the patient's in a semi-sitting position. It makes it a little easier for me to position the person. Not the best job in the world of applying the sling, but it's going to have to do. We turn here. Being extra cautious about the individual, and you can see again how close you are to the hanger bar, or to the actuator. Open up the base. Now, in this position, you may need to give somebody some assistance in getting back where they need to be in the chair, so you can use these handles on the side. kind of help get the person positioned properly in the chair when you lower them down. You always want to spend a little extra time doing that so you don't have the potential of having to reposition them again once they're down, because that's a lot of work. And that's how we transfer from the bed to the chair. Let's pause for a second.